can my rotten teeth be saved? Well, that depends. What are rotten teeth, you ask? Well, there are several different things that can cause cause you to have rotten teeth, I should say. 1 being bacteria, 2 being acid in the mouth, and 3 being plaque and tartar. There's several different stages of rotting, so we're going to be able to go over that with you. My name's Erica, and I'm the lead surgical assistant over at Summit Point Dental Implant Center.
Hi, I'm Dr. K. I'm the owner of Summit Point Dental Implant Center, and we've helped thousands of patients take care of their teeth and give them their smile back by fixing issues that we're about to discuss.
Perfect. Okay, so let's go ahead and jump right in. One of the many things people want to learn about is teeth decay. Okay, so that's the number one reason why teeth start to rot. And there's several different reasons why people start to get teeth decay. So Dr. K is going to kind of elaborate on some of those reasons. First reason being bacteria in the mouth.
Of course. So, the thing is, the question I always get asked is why am I getting rotten teeth in the first place? So that depends on a lot of factors. It could be your diet, it could be your lack of hygiene, it could be genetic factors. Everyone's mouth is comprised of a lot of bacteria, and there's different pHs, drinking water versus sodas, things like that. So there are early signs of what's called rotten teeth or starting of a rotten tooth, and it progresses. It can take months to many years for that to develop. So early signs will be like if your tooth starts to become sensitive, or you start to see white spots on your teeth, for example. So those when it's at that stage, some of the tooth structure, the enamel that's protecting the tooth, the white part of the tooth, that can be remineralized. So you can use like fluoride toothpaste, great hygiene, cut down on the sodas, anything acidic, even like Monster drinks, like Celsius drinks, Gatorade, things like that are very acidic and not the best for your enamel. So those are things that can prevent you from getting rotten teeth in the first place. Okay, so as we go, and we don't address it, and your teeth are, the bacteria is there, and the plaque is there. Now you're starting to get holes into the teeth, and the bacteria is kind of now eaten into the tooth, and that's where the rotten teeth phenomena starts.
Perfect. So let's dig a little bit deeper on those. Basically, when we all have good and bad bacteria in our mouth, okay? So it's just about neutralizing, like Doctor said, with the pH balance. If you're not drinking enough water, or you take a lot of medications and you have, like, say, diabetes or anything like that, all of that is going to contribute to the bacteria in your mouth. A lot of us have, some of us, even including me, have had our gallbladder removed. And once you have that removed, we all know, for those of us who have had it, that we tend to get a little bit more acid reflux because our body does not break down the food as fast as it would if we did have our gallbladder. So these are just little indications of things to keep in mind. If this is something that you've had done, if you take a lot of medications, if you have dry mouth, if you've had your gallbladder removed, or you have to take Nexium, or maybe pantoprazole, I believe is what it's called, or Protonix, because you get a lot of acid reflux, then more than likely you're going to be at a higher risk of having that bacterial early tooth decay. So when you start seeing those signs on your teeth, like the white spots he mentioned, or if you start seeing a lot of buildup and tartar around those teeth, and you're not getting your checkups and cleanings every 3 to 6 months as recommended by the ADA, then you may want to do that, because a lot of this stuff can be stopped ahead of time if you would like to keep your natural teeth.
Right. So, let's, a question we kept asking or getting asked a lot is, I brush my teeth, I floss, I go to the dentist every 6 months, but I love to drink Gatorade. So what do you tell those people that are, that drinking a lot of sodas or energy drinks?
Right, exactly. Well, those have a very high sugary, acidic balance in them. So when you're drinking those on a daily because you think, this is good for me, it has electrolytes, it does have electrolytes, but you still need to be rinsing your mouth out with water afterwards or brushing. The longer you let that stuff sit on your teeth, the more it's going to continue to break down your enamel, and it's going to break down a lot faster than it should.
So on that, basically you want to make sure that if you're going to have those drinks, that you're rinsing your mouth out to make sure that acidity, the sugar, all that is wiped off. It's not staying on your teeth to cause those cavities in the first place. But that's something that we get asked a lot is they're doing everything right, but they're still getting cavities, and that's usually why. So let's go through the steps of, okay, so now you have sensitive teeth. What's the best, option or treatment to take care of that? Okay.
I would say listen to the signs. If you are eating something and you feel like, after you eat that or you take that bite of something sweet or something spicy, if you get like a little tinge in your tooth, that's usually an indicator that something is wrong or something may be starting. If you're seeing those dark spots and you're like, wow, that spot seems to be getting just a little bit bigger, that's more than likely active decay. If you neglect that and you let it sit longer, we're going to be moving through the stages from early, which is pretty much savable or reversible, to more of a moderate stage. Dr. K, can you tell us a little bit more about the moderate stage?
So going back to this earlier signs, those can usually be fixed with like fluoride toothpaste, for example. Some of that enamel can be remineralized. Sometimes if it is a small cavity, it can be filled. It can be fixed with a small filling, and that usually takes care of it. And as long as you have good oral hygiene and brushing habits, that should take care of the problems. Sometimes if that decay gets worse, the rotten teeth basically phenomena progresses, then you may need more work. That cavity now is bigger and it's taking up more tooth structure in your mouth, so on your tooth. So to fix that, usually you're going to probably need a crown or some kind of inlay onlay type material to protect the tooth structure that's basically gone. And now if you let that progress even more, now you're getting basically the nerve is involved. So now you have a necrotic nerve or pulp inside the tooth. Now you're having either pain or you even have an infection or abscess. You probably see a pimple in the gum line. That's an indication that there's something more severe going on with the tooth. Some of those teeth can still be saved if it's caught early. You got to be put on antibiotics. You have to go get to an endodontist or your general dentist to get that treated for you. So those are still fixable. Okay. Unfortunately, we also have the patients who do come into our teeth and the rotten teeth, exactly what it says. I mean, their teeth are pretty much broken or dissolved to the gum line, and only the root tips are usually there, or most of the tooth structure is already missing. These have probably been there for been like that for many years. For whatever reason, the patient or the individual has not wanted to go to a dentist. It could be through fear, or financial reasons, or lack of insurance, things like that. So, but it's so important that when you see signs of tooth pain or sensitivity, or you're starting to see things visibly in the mirror, or someone tells you, oh yeah, there's something going on with that tooth in front of your smile zone, you definitely want to go get it checked out. You don't want to wait months or years to get it fixed, because a lot of times it can be saved. So that's a goal in the first place, to save the tooth.
Okay, so let's talk about more what happens if you neglect those teeth. So the doctor's already kind of told you don't want to let those sit any longer, because again, one of the main reasons why people don't get the treatment done is usually fear is the number one reason, because it's the fear of the dentist, it's the fear of the injection of the needle. But number two is usually finances. A lot of people are very insurance driven, so they only want to do what the insurance is going to cover. Now, the good thing about insurance is they're actually pretty good about covering your preventative and your basic, which would be considered, early to moderate. So once we start letting those sit longer just because of the fear, you're looking at more pain, you're looking at more finances, because once they step into that major, which is usually like your root canals, your crowns, extractions, implants, you're looking at more money because they don't pay as much on those services. I'm hoping that you're enjoying everything about this video. And if you are more interested in learning more, please give us a call at 469-625-0005 so we can get you scheduled an appointment for a consultation or even your first checkup and exam. Remember, the first one is always a good one. We don't plan on doing anything that's going to hurt you. We just want to see what's going on and educate you on what's going on in your mouth so you can make the best decisions for you. But let's keep going.
All right, so now that let's talk more about the more severe, now that, your teeth have been broken down, they're decayed, and they're not restorable. So we do consultations on these patients that are at this stage, and we basically kind of tell the patient that, trying to save the teeth that are still remaining is not going to be a good option, just because anything we put on it is not going to last. It's already too much structure. The foundation is already compromised. So at this point, we're looking at removing those existing teeth that's still there, and also basically starting over. And there are different options that are presented to patients. Some offices do offer dentures as a treatment option, and for some people that may be a good option, especially patients who don't have a lot of bone. But if you're younger and you have good bone, even if you're older and have good bone, my recommendation is this: considering to consider to getting dental implants placed, whether in the form of like a snap-on type of denture where you're getting more retention with the prosthetic, or just a concept that we call the All-on-X, which is basically implant supported bridge, that this is fixed. It's the closest thing to your natural teeth that you can basically eat and chew well with. But it comes with a caveat, because if you didn't take care of the teeth in the first place, getting this is kind of like starting over again. So we want to make sure that patients that are considering doing this type of treatment are going to be really good with their hygiene, because you still have to clean them, you still have to take care of them, similar to your natural teeth. So it just gives you another option, and it's a great option, but like I said, it does require a lot of upkeep as well.
Keep in mind that when you come to the dentist and we tell you these things that need to be done, we give you a treatment plan. This is just us educating you on what's going on in your mouth. So when you have to decide what needs to be done, a lot of times you can prioritize what needs to be done first, which is more serious and things that can wait. In most offices, we will try to help you utilize your insurance if you are utilizing insurance, but then there is going to be some things that you may have to pay out of pocket. Now, keep in mind that, again, the longer they sit, the longer and, basically bigger that decay or that problem or pain or infection is going to be. So try to think ahead, plan, and know that there are financing options and there's a lot of other things that can be done to help you get the treatment done. You just have to ask all the right questions.
Right. And we also want to make sure that, you also consider, especially if you have dental insurance and you want to utilize your dental insurance. Sometimes if your treatment is a lot and you have a lot of active decay, some patients I only want to do what the insurance covers for this year. And, if it's in January or like first part of the year, waiting a whole another year to try to fix other teeth just because your insurance is not going to pay for it that year is not a good idea, because sometimes teeth can be saved, and if you wait that long, the next year the tooth may have to come out, and then now you're talking about surgery, you're talking about more discomfort and usually more cost associated with that. So you definitely want to put your health first. That's number one.
Yes. So go ahead and schedule that appointment. Find an office near you or give us a call. Like I said, get that first visit taken care of. If you have insurance, it's usually covered at 100%. And then if you don't, like I said, that's okay. We do make it nice and affordable for you. They'll give you the pricing on the phone, but come in, see our hygienist, get those x-rays done, get that cleaning done. Because again, one of the main reasons for rotting teeth is plaque and tartar buildup. Okay, so we need to make sure that we can get everything off your teeth and keep your gums nice and healthy as well. We do need to talk about a few of the reasons that people don't want to get the treatment done. One we've already talked about is finances. Two is fear. Dr. K, can you give us any more examples of why a lot of people hesitate to get the teeth treatment done?
Right. Sometimes it could be just because, hey, my mouth doesn't hurt. Why should I get it? It's not hurting. Why should I get it fixed? And then all of a sudden it starts to hurt, and then they're coming to the dentist. So my recommendation is don't wait for it to hurt. If you see that something doesn't look right or doesn't feel right in your mouth, using the, what used to work in the past or something hurting to go to the dentist, at this point, it could be a lot worse once it is painful. So the sooner you can get in, the sooner you can have your dentist get it checked out, the better it's going to be for you. And usually the prognosis is a lot better usually at that time.
Perfect. Okay. And then one more reason I think a lot of people don't get it done is just because life in general, we're all so busy, and trying to find the time to squeeze or having to request off of work to come in to get the treatment done can also be a little time consuming. So when planning with your dentist or with your hygienist, once we figure out what needs to be done, we can always, if you just let them know ahead of time, try to plan to get as much of the services as you can done in that one visit so you don't have to come back as many times. We can definitely minimize the visits if we know ahead of time whether you travel a lot for work or whether, you've got soccer games to go to and you have to work to a certain time or you're on night shift, we'll definitely try to find ways to make it work for you. So that's just a few of the reasons why a lot of people don't get it done, but just know that we're here for you.
Awesome. Well, I hope you found this video helpful, and I definitely want you to subscribe to our station. I want you to watch our next video about why are dental implants replacing dentures.
Perfect. We'll see you next time. Thanks for joining us.